Our journey so far has been an easier one, at least comparatively an easier one. But now we have to step up a little bit. And what I mean by stepping up a bit is that now we kind of start with the cranial bones, which are having a little bit more extra information compared to the cranial bones which we have studied so far. And in our list of a little bit challenging cranial bones, the first bone that we study today is the occipital bone. Now, this thing of ours, it's turning out to be a game, right? Now, in the game, at the very first or rather initial levels, the bosses that we actually encounter, the boss fights that we encounter, they're easier, right? But through the game, with experience, we kind of level up our character. And so the bosses that appear against us for combat, for an extra challenge, they are much more difficult to beat. So just like that, we have defeated the easier bosses of, the monster of mandible, or the frontal bone, or the parietal bone. But now, the game of anatomy is catching up with us, and it is throwing off more difficult and challenging bosses for us to encounter. And the first boss, which is actually a little difficult, I'm not obviously discouraging people, but it's just a bit challenging, is the occipital bone, which we study today. But obviously, a systematic approach will decrease the difficulties, just like any planned combat decreases the difficulty of the boss that you're fighting against, which was essentially what Dark Souls was all about. Anyways, so the occipital bone. The very first thing that we obviously do, and it has kind of become a cliche by now, is actually locating the bone in the real skull, right? So for locating the occipital bone, the anterior aspect of the skull, which we are seeing right now, is not going to suffice. Because the occipital bone is a bone which is posteriorly located. So the posterior aspect of the skull reveals to us this beautiful bone that is occipital bone, which we are going to discuss right now. So this over here is the occipital bone. Now, if we isolate this bone and kind of look at it, the very first thing that we are seeing here is the external surface of the occipital bone, right? We are seeing the occipital bone from the external aspect. So this is the external surface of the occipital bone. Whereas this over here is the internal surface of the occipital bone, right? Right. So this is the first thing that we appreciate. But even before appreciating the more subtle features of the occipital bone, the very first thing that we can see over here is a large hole over here. And this large hole or foramen is a very famous one, and we call it to be the foramen magnum, which obviously we know about, right? The foramen magnum is the foramen through which the medulla oblongata continues as the spinal cord, and other structures also pass through. So it's a very important structure, and it is located in which bone we are seeing? Yes, the occipital bone. So recognizing the occipital bone is a piece of cake, because it has this huge giveaway over here, that is the foramen magnum. But you see, the foramen magnum is more than just an identification feature for occipital bone. Obviously, we can identify the occipital bone from the foramen magnum, but the foramen magnum is also serving another purpose for the occipital bone. What is that purpose? That purpose is, listen to me very carefully. Again, I'm very sorry. Yes, that purpose is, this foramen magnum actually divides the occipital bone into 4 parts. What are the 4 parts, you may ask? So you see this over here, this large, smooth, bony plate, which is kind of quadrilateral in shape, which is lying kind of, you can say, posterior to the foramen magnum. If you are confused, then let me remind you that this over here, notice the mouse pointer, this side is the posterior side and this side is the anterior side. I hope you can understand that. Right now we are seeing the occipital bone in the lateral view. Yes. So this over here, this large bone plate, this is the squamous part of the occipital bone, right? So it is actually a quadrilateral plate which is extending above and behind the foramen magnum. Okay, done. So that was a huge surface, which is a squamous surface, the squamous part of occipital bone. But what are the other parts of the occipital bone? For that, we divert our attention towards the anterior aspect of the foramen magnum. See, this over here, this thick, bony, you can say stem-like projection, this is what we call to be the basilar part of the occipital bone. So it is essentially, if I show you the superior view, can you appreciate how this basilar part is actually situated in the anatomical position of the occipital bone? See, it is actually oriented, what we can say to be forwards but upwards. So if we bring back the skull, see, this is the occipital bone. If we remove the left temporal, we cannot see it yet because, yeah, we can kind of see it. See, so this over here, this is the what we call to be basilar part of occipital bone, the basal occipital, right? So this over here, this is what we call to be the basal occiput, right, or the basilar part of the occipital bone. And in the anatomically positioned occipital bone, you can see that it is actually projecting upwards, forwards, obviously forwards, but upwards also. And this projection or this position of the basal occiput is a very important factor which we need to keep in our minds when we are holding the occipital bone in anatomical position, right? So let me isolate the occipital bone again. And you can see that in the anatomically held occipital bone, which will be oriented somewhat like this, the foramen magnum is completely horizontal, right? And the basal occiput is projecting forwards and upwards, right? The other 2 parts of the occipital bone which we were talking about, or which we are to talk about, are these bony handles. You can kind of call them handles, right? These bony ridges, not ridges, these bony projections, which are kind of connecting the basilar part with the squamous part, right? This part of the occipital bone is what we call to be the condylar part of the occipital bone. Why? Because it has in its inferior aspect these occipital condyles, by which the occipital bone will articulate with the C1 vertebra or the atlas vertebra. We will obviously see to that in more details. But for now, after having described the 4 parts into which the occipital bone is actually divided into by the virtue of the foramen magnum over here. Now let's describe, or let's look into details of the squamous part, starting with the surfaces of the squamous part. The squamous part, as you can obviously appreciate over here, has this external surface and internal surface, right? Along with 4 borders. Listen to me very carefully. 4 borders. What are the 4 borders? One over here, like this. The second one is over here, like this. Third one is kind of like this. And the fourth one is this. That is why I was telling that it is quadrilateral in shape. Do you remember another bone which was quadrilateral in shape? Yes, the parietal bone. Although the parietal bone had a better shape than this. Okay. So these 2 borders, which are superiorly placed, these are what we call to be the 2 superolateral borders of the squamous occipital bone. Whereas these 2 borders, which are inferiorly placed, they are the inferolateral borders of the squamous occipital bone. How about angles of the squamous occipital bone? We talked about the borders, so it only makes sense if we talk about the angles of the squamous occipital bone now. See, over here, there is the formation of one angle, which is the superior angle. That is between the 2 superolateral borders. Okay, right? Whereas over here, between this superolateral border and this inferolateral border, and the same over here, there are 2 angles being formed. Okay, these 2 angles are what we call to be the lateral angles. Okay, so these angles are the lateral angles of the occipital bone. So we said that the squamous occipital bone is quadrilateral. So shouldn't it be quadrangular as well? Right? But we only counted 3 angles. So where is the 4th angle? Actually, common sense dictates that the 4th angle will not be present. Why? Because the squamous occipital bone is ending over here in front of the condylar part, right? It is ending. So there is no formation of any angle over here in the, you can say, posterior aspect, right? So there is no angle over here and only 3 angles are present. Now, let's talk about the surfaces in a little bit more detail. So this is the external surface of the squamous occipital bone. And the very first thing which you can demarcate very soon is the presence of these bony lines, right? We will talk about these bony lines in a few seconds, but before going on to the bony lines, let's talk about the point on the squamous occipital bone where its convexity is the maximum. That is called the external occipital protuberance. So the external occipital protuberance is over here, which you can appreciate laterally. Okay, see over here. You can appreciate that. So now listen to me very carefully. The external occipital protuberance is the point on the external surface of the occipital bone where it is showing a protuberance or a point of high convexity. Now, within the external occipital protuberance, there is another point which is actually the maximum convex site of the external occipital protuberance. So the external occipital protuberance, it is a protuberance near the center of the external surface, right? It is a bit widespread. But even in the external occipital protuberance, we have a point, right? Which is the highest point of the external occipital protuberance, which is called the inion. Okay, it is called the inion. Now, this inion, this point is very important. Why it is very important is this inion gives rise to two very important lines across the occipital bone. The first one is over here. Okay, see, this is the inion right over here. You can make it out, and from this two lines are emerging out. These are the superior nuchal lines. The superior nuchal lines are not the only lines which are actually emerging from this inion. A little bit superior to the superior nuchal lines, we have a very faint ridge or faint lines emerging from the inion as well. Emerging from the inion itself. That is what we call to be the highest nuchal lines. So the superior nuchal lines and even superior to the superior nuchal lines, that is the highest nuchal lines, both these two lines actually emerge from the inion. Now the thing is, the highest nuchal lines are not very visible in this model. Okay, it is not very visible in this model, and in the real anatomical skull also it is quite faint. That is my understanding. But the superior nuchal line is very prominent. What other is prominent is this over here and this line over here. What are these? See, from the inion, which is somewhere over here, a thick crest runs towards the foramen magnum. This thick crest is what we call to be the external occipital crest. So the external occipital crest is running from the inion superiorly to the foramen magnum's posterior boundary, right? Now, this external occipital crest at roughly its midpoint is giving rise to another set of nuchal lines. This set of nuchal lines is what we call to be the inferior nuchal lines. So, two superior nuchal lines from the inion, two highest nuchal lines from the inion, and two inferior nuchal lines from the midline of the external occipital crest. Okay, so far so good, right? Now I'll show you why these lines are important. See, these lines, superior, highest, inferior nuchal lines, this external occipital crest, all of these are actually potential sites of attachment of different muscles of the neck region and the back region. Okay, so it is quite essential to understand the anatomy as to what muscles are involved, right? Right. So let's jump onto that. So now this is the occipital bone, obviously. Hope you're not confused as to what these things are. This I had to draw on the occipital bone for actually making some sense about the different muscle attachments across the different line. Okay, so please don't judge me according to my drawing. It's pretty horrible, I know it, but I feel like it should get the job done. See, we are not here to pinpoint locations of the muscle attachments. Okay, obviously this diagram is not for scale. It's not like these are accurate. But what this diagram, or what I will try to explain, is at least the basic concept, at least the basic understanding of where the muscles are. Is it medially? Is it laterally? Is it between the two nuchal lines? Or is it attached to the nuchal line? Only the basic things. So I feel like this should suffice. Now listen to me carefully. See, firstly, let me explain what these black lines are. Obviously, you can make out these are the nuchal lines. This is the inferior nuchal line, right? This over here is the superior, external occipital crest, right? This over here is the inion, okay? This over here is the superior nuchal lines, whereas these over here, these are the highest nuchal, right? Now, these different colored, you may say circles, ellipses, whatever shapes these are, they are meant to represent different muscle attachments. Now, the good news is that this is symmetrical. That is, whatever muscle is attaching over the right side is also being attached to the left side. So we do not need to double our efforts. We can just learn one side and the other side will automatically be learned, right? So let's start with the superior nuchal line. The medial attachment on the superior nuchal line, hear me out very carefully. The medial attachment on the superior nuchal line is of the muscle trapezius. Okay, so the trapezius gets attached along this and along this over here. Further laterally, we can see two muscles, right? Two muscles. One muscle, this one, right? This one is the posterior fibers of sternocleidomastoid. Okay, posterior fibers of sternocleidomastoid. Whereas this one over here, just below it, we also consider this as an attachment to the superior nuchal line. This over here is the muscle of splenius capitis. Okay, so it is the splenius capitis. These are all new names. These should be new names, not the sternocleidomastoid or the trapezius. I feel these are two very popular names, and we have learned about them somewhat when we were talking about the upper limb anatomy. But other muscles which we will be talking about, or just like the splenius capitis, these are new names for us. So it would take just a bit of time to get used to this, but obviously there is nothing to panic about. Okay. So sternocleidomastoid posterior fibers, just below that is splenius capitis. Done. Highest nuchal line, you can see at the very lateral end there is muscle attachment, right? That is actually what we call to be the occipital belly of the occipitofrontalis muscle. The occipitofrontalis muscle, it is forming an aponeurosis which we call to be the gallia aponeurotica, right? The epicranial aponeurosis. So that aponeurosis is attached along the rest of the highest nuchal line. Whereas the occipital belly of the occipitofrontalis muscle, or the occipitalis muscle, see, the occipital belly is also called the occipitalis muscle. Okay, they are attached along the lateral ends of the highest nuchal lines. Okay, and obviously they will go and get inserted onto the epicranial aponeurosis, whereas the epicranial aponeurosis itself will be attached to the rest of the highest nuchal line. Done. So that completes the superior and the highest nuchal line. What about the area between superior nuchal line and inferior nuchal line? That is where also things gets a little bit interesting. See, just medial. What is this, by the way? Yes, very good. This is the external occipital crest. By the way, let me get one thing straight here. See, this external occipital crest, it also has an attachment. This will actually give attachment to what we call to be ligamentum nuchae. Okay, the ligamentum nuchae. So that's just one piece of information I wanted to get out of the way. Now let's delve on to these insertions, or rather these attachments between the two nuchal lines. Medially, over here, this one, this is what we call to be the semispinalis capitis. Okay, the semispinalis capitis. Whereas laterally, these muscle is what we call to be the obliquus capitis superior. Okay, the obliquus capitis superior. Interesting name, and it's quite complicated also. So again, I was actually trying to look for some mnemonic, but I really couldn't find any. Maybe at the time of editing I would find any and maybe I'll put it there. I don't know. But as far as me during recording this video is concerned, I have not yet been able to devise any mnemonic for remembering the attachments here, so sorry. Below the inferior nuchal line, there is again a medial attachment and a lateral attachment. This one, this medial one, is known as the rectus capitis posterior minor, and the lateral one is called rectus capitis posterior major. Okay, this rectus capitis, we will see a lot of these muscles when we will be talking about the other aspects of the occipital bone. Obviously, this entire part above the highest nuchal lines, this will be covered by the epicranial aponeurosis. Now, just one little information more. The area above the superior nuchal line, the superior nuchal line is over here, right? The area of the occipital bone above that is what we call to be the planum occipital. Okay, the planum occipital. Whereas the area below that of the superior nuchal line is called the planum nuchal. Okay, planum nuchal, planum occipital. Done, right? Okay, okay. All right. Now, having talked of the external surface, let's move on to the internal surface of the squamous occipital bone. Okay. Now, a good thing about the internal surface is that it is a lot similar to the external surface, right? So you can already make out that there are some markings over here, just like the external surface was, right? See, what happens is that just like the external surface had the external occipital protuberance, just opposite to that area, in the internal surface there is the internal occipital protuberance. Okay, somewhere over here, the internal occipital protuberance. Now, from the internal occipital protuberance, there are 4 lines which are intersecting at the internal occipital protuberance. So the internal occipital protuberance is kind of the meeting point of 4 lines. What are they? See. Superiorly, is kind of visible laterally. Can you make it out? Yes. Superiorly, we have what we call to be the sagittal sulcus. The sagittal sulcus. Inferiorly, we have what we call to be the inferior occipital crest. See, just like the occipital, superior occipital crest was there from the inion, which was a part of the external occipital protuberance. Just like that, from the internal occipital protuberance, we have the what we call to be internal occipital crest. Transversely, we have what we call to be the transverse sulcus. Okay, the transverse sulcus. Now, what happens is very interesting. So please do give me a good listening here. These sulcus, these sulci that I'm talking about, they obviously lodge something. What do they lodge? They lodge different sinuses. Okay? They lodge different sinuses. Now, 4 sulci lodging 4 sinuses means that these sinuses are kind of meeting over in the inferior, or rather internal occipital protuberance. The internal occipital protuberance was the meeting point of these 4 lines, which brought the sinuses. So the sinuses are kind of meeting over in the internal occipital protuberance. So this point is called the confluence of sinuses point. It is a point of confluence of the different sinuses. Now let's give a very quick look at what sinuses are we talking about and what structure actually lodges those sinuses. See, superiorly, I talked about the what sulcus? Yes, the sagittal sulcus. Now this sagittal sulcus is not something very new to us. We have been seeing the sagittal sulcus from the frontal bone, continuing on to the parietal bone, and now to the occipital bone. Throughout its extent, it lodges the superior sagittal sinus. So over here, since this is the terminal part of the sagittal sulcus, we have what we call to be the terminal part of the superior sagittal sinus, right? So that is one line or one sulcus accounted for. What about the transverse sulci? They also should bear some sinuses, right? They also should lodge some sinus. So the transverse sulci actually lodge the left and right transverse sinus. Okay, so it's a good thing that the name of the sulcus is reflected in the name of the sinus, so we don't have to worry. Okay, so the transverse sulcus is bearing the transverse sinus, and obviously there are 2 transverse sulci, the left one, the right one. What about the internal occipital crest? Now the internal occipital crest is lodging the occipital sinus. Very important. So internal occipital crest actually lodges the occipital sinus. So occipital sinus inferiorly, transverse sinus is laterally, and the superior sagittal sinus superiorly. They all confluence at the internal occipital protuberance. Hence, this is a very interesting and also important point of the internal surface of the squamous occipital. However, since this is, what did I say at the very beginning of the video? That this is a little bit challenging boss fight, okay? This is not like frontal bone or mandible, okay? So there will be an extra edge to everything. The extra edge onto here in this perspective is that the information does not end here. There is one more piece of information that we have to learn. See, what did I say? about the sinuses which are lodged into the sulcus, right? But that is not the only thing that the sulci are doing. The borders of the sulcus, the borders of the different sulci, they are actually attached to the different foldings of the dura mater. The dura mater, which is one of the meninges, the outer meninges of the central nervous system, it is actually thrown into a few folds, a few type of folds in onto the what we can say to be this brain. Obviously, we will talk about those in details when we talk about the neuroanatomy, but for now, it would suffice for us to know about what the names of those foldings are, how those foldings are actually placed, located, what they're doing, how they're dividing the fossa and all the details will be covered in neuroanatomy. But for now, let's just move on to how and what are attached onto the boundaries or margins of these different sulci. So we talked about the sagittal sulcus, right? See, the sagittal sulcus, not only in the occipital bone, throughout its extent, over onto the frontal bone and parietal bones, all throughout its extent, it is actually providing attachment to the falx cerebri. The falx cerebri. See, falx cerebri is a folding of the dura mater. The internal occipital crest boundaries are actually providing attachment to another folding of the dura mater known as falx cerebelli. So please do note the difference here. Superiorly, it is falx cerebri. Inferiorly, along the same line, vertically, we have the falx cerebelli. The transverse sulci, their boundaries are providing attachment to what we call to be, listen very carefully, this is not a falx. This is what we call to be the tentorium cerebelli. Very important attachment and very important folding of the dura mater as well. See, this tentorium cerebelli, this is attached to the boundaries of the transverse sulci of the internal aspect of the squamous occipital bone, right? So our discussion regarding these attachments of the different foldings of the dura mater, this has something to do with the underlying sinuses as well. We talked about the different sinuses which are lodged, but now we need to talk about how they are correlated to the different attachments. See, let me get this clear for you. See, these superior sagittal sinus, do you remember it? The superior sagittal sinus? Actually, how it ends is by continuing as the right transverse sinus. Are you getting me? Am I making sense? The superior sagittal sinus, it is coming, reaches over here, then it takes a right turn and it continues as the right transverse sinus. Okay, so that is an important piece of information. Whereas, listen to me very carefully, this is where I was talking about the correlation of the different attachments with the underlying sinus. See, this is the anterior aspect. I talked about the tentorium cerebelli, right? The tentorium cerebelli, it is coming from the anterior towards the posterior aspect, and it is being attached to the transverse sulcus boundaries, right? How it is coming? It is coming from the anterior to the posterior direction, like this. Okay. Now, the tentorium cerebelli is bringing with it within it the straight sinus. Okay, so a straight sinus is actually coming with the tentorium cerebelli from the anterior towards the posterior aspect. Now the tentorium cerebelli is coming and getting attached over here along the margin, along the boundary of the transverse sulcus. But what is happening to the straight sinus, which is contained within the tentorium cerebelli? That is actually coming anteroposteriorly and then continuing as the left transverse sinus. So the superior sagittal sinus is coming inferiorly and then continuing as the right transverse sinus, whereas anteroposteriorly the tentorium cerebelli is bringing along with it the straight sinus, which is coming, and the tentorium cerebelli becomes attached to the transverse sulci borders, whereas the straight sinus is continuing as the left transverse sinus. So that accounts for all the attachments and all the sinuses. Okay, just one more piece of information, that is, do you see these hollow depressions? 1, 2, 3 and 4. See, the 4 sulci, they are actually dividing the entire inferior aspect, not inferior, internal aspect, into these 4 fossa, right? It's too obvious that they are actually doing that. What we need to just remember, it's not at all difficult to remember this, is that the superior fossa, the superior fossae rather, they are lodging the what we call to be posterior pole of the cerebrum. So the posterior pole of the cerebrum, obviously for obvious reasons, it is going to be lodged onto the superior fossae over here, whereas the inferior ones over here, you can see they are very distinct, right? They will lodge the cerebellar hemispheres, the left and right cerebellar hemispheres. That is, the cerebellum is lodged over here. When we will learn about the different foldings in details in neuroanatomy, we will come to know that the tentorium cerebelli, what it does is, I told that it comes anteroposteriorly, kind of, right? Not the vertical ones, like the falx one, the falx cerebri or the falx cerebelli, not like that. Tentorium cerebelli is transversely attached, anteroposteriorly, like this. So what it is doing is actually, it is dividing the posterior cranial fossa into supratentorial and infratentorial regions. The posterior cranial fossa, where this entire thing is happening, obviously, and the occipital bone is also contributing in the formation of that posterior cranial fossa. So the tentorium cerebelli actually divides that posterior cranial fossa into the supratentorial and infratentorial regions. But obviously, we will learn about that in details when we learn about neuroanatomy. Okay. Having talked of the surfaces of the cerebellar, or not the cerebellar, I'm sorry. Having talked of the surfaces of the squamous occipital bone, let's very quickly talk about the borders. So I've already said that there are the superolateral borders and the inferolateral borders, right? Too easy. See, the superolateral borders are actually articulated with the posterior boundary or the posterior borders of the parietal bone, and they form what we call to be the lambdoid suture. So very quickly, let's give it a try. As you can now see, these are the superolateral borders articulated with the posterior borders of the parietal bone, forming the lambdoid suture. This over here, this angle is the superior angle of the occipital bone. You can very well see that this is the meeting point of what we call to be the sagittal suture and the lambdoid suture over here. This is what we call to be the lambda, right? Lambda. We know all these things. That is why I'm telling this quite fast. The lambda is actually the site of the posterior fontanelle in the fetal skull or the fetal skeleton. Posterior fontanelle is located in the lambda region. What about the other boundaries? You can very clearly see that the inferolateral boundary, here there is a sharp turn, right? This is the lateral angle. Can you make it out? The lateral angle, very clear, very distinct. The lateral angle is formed due to the shift of the superolateral to inferolateral boundary, right? Let's first talk about the inferolateral boundary. So the inferolateral boundary or border, what is it articulated to? It is articulated to this bone. What is this bone? This is the temporal bone. Okay. But obviously we need a little bit more precision because we are studying anatomy and we are not studying biological science. So studying anatomy, we can be a little bit more precise and say that this articulation between the inferolateral boundary is with what we call to be the mastoid part of the temporal bone. So it is with the boundary of the mastoid temporal bone. We will obviously talk about the different regions of the temporal bone later in a discussion, but that should suffice for now. Okay, so that is the inferolateral border for us. Okay, and this obviously is the lateral angle. This meeting point of these three bones, that is the parietal bone, the occipital bone, and the temporal bone, or rather the mastoid temporal bone, to be a little bit more precise. This is what we call to be the asterion. So we had the lambda over here, and we are having the asterion over here. Okay, the asterion, that is also the site of the posterolateral fontanelle in the fetal skull. In the fetal skull, the posterolateral fontanelle is located over in the region of asterion. Okay. Having talked of the surfaces, the borders, and the angles of the squamous part, we are now free to explore the other regions of the occipital bone. The other regions of the occipital bone are what I said to be the basilar part and the condylar part, right? So let's very quickly get on with the basilar part of the occipital bone or the basal occiput, right? So this over here, this is the basal occiput. Okay, this projection, bony projection. As you can see, it has three surfaces. What are the three surfaces? This is the superior surface, the superior surface, the anterior surface, okay, and the inferior surface. Okay, done. Pretty self-explanatory. Whereas, what are the borders that it has? It actually has two lateral borders. Pretty easy. Two lateral borders. Done. Okay. Now, see. Let's talk about firstly the superior surface of the basic occiput. The first thing that we have to learn about this basic occiput is where is it articulated to? How is this part actually situated in the real skull? That we have to know, obviously, right? So To know that, we have to bring back the skull again. So, as you can well appreciate, when we remove the two parietal bones in the superior view, we can obviously see that this over here, this is the basi-occiput. See, if I zoom in, you can well appreciate this is the foramen magnum over here, right? This is the foramen magnum. This over here is the squamous part, internal surface of the squamous part, okay? So this over here, you can well appreciate that this is the basi-occiput. So if this is the basi-occiput and the surface over which the mouse pointer is currently located on is the superior surface, then can you see this articular margin over here? This articular margin is actually the articulation between the basi-occiput and the sphenoid bone over here. See, in green it is demarcated that this is the sphenoid, and this part of the sphenoid, this midline part of the sphenoid, is the body of the sphenoid. So to the corresponding part of the body of the sphenoid, the basi-occiput's anterior surface is articulated. Done. Having talked of the anterior surface, let's talk about the superior surface. Okay. First thing that we have to appreciate is that when held anatomically, which I have said in the beginning of the video, that when held anatomically, the superior surface is, how is it? It's sloping. Okay, it's like a slope. So it is sloping surface and it is extending from, obviously over here, this is the body of the sphenoid over on this side, to the, what is this? The anterior margin of the sphenoid, anterior margin of the foramen magnum. Okay, so that is a sloping surface and extending from body of sphenoid to the anterior margin of the foramen magnum below, right? Now, when I showed you the articulation of the occipital bone with the sphenoid bone, let's see that again. So this is the lateral view of the sphenoid bone articulated with the occipital bone, and we can well appreciate how they're articulated along the basilar part of the occipital bone. What I was talking about was the superior surface. See, the corresponding part of the body of the sphenoid along with the superior surface of the occipital bone, they are forming a flat, resting, sloping structure. We can well appreciate this, right? This is forming what we call to be the clivus. Okay, the clivus. Okay, what the significance of this structure, this resting platform is that it is actually supporting two very important neuroanatomical structures. What are those neuroanatomical structures which this clivus is supporting? They are actually the pons and medulla oblongata. Very important, very important. So the pons and medulla oblongata are actually being supported over here along the clivus, but that's not all. That is not all. See, between the superior pons and medulla oblongata and the inferiorly located superior surface of the clivus or the superior surface of the basi-occiput, between the neuroanatomical structures and this basi-occiput, we have another structure, that is the basilar artery and its branches, and also the basilar plexus of veins. So what are the structures which are associated with the superior surface of the basi-occiput? Count with me, okay? First, we have the pons. Second is the medulla oblongata. Third, below those structures and above the superior surface, we have the basilar artery and its branches. And since there is an artery, so there is a corresponding veins also. That is the basilar plexus of veins. Okay, done. Now, having talked about the neuroanatomical structures, let us talk about some of the other important structures which are actually attached to the superior surface of the basilar occipital bone. So listen to me very carefully. See what we have here is, we talked about the pons, medulla oblongata, basilar artery and basilar venous plexus, right? But what is happening is, over here there is the anterior margin of the foramen magnum. We can well appreciate that. Close to this anterior margin of the foramen magnum, the superior surface is actually providing attachment to some membranous structures. Very important. Some membranous structures. What are these membranous structures? They are from above to below. Number one, the membrana tectoria. Number two, the vertical band of cruciate ligament, or it is also known as the ascending band of the cruciate ligament, right? And we have the apical ligament of dens. Things are getting a little bit overwhelming, but that's why there was a disclaimer at the very beginning that this is a difficult boss. But we cannot give up on this boss, right? We cannot give up on this boss battle. We have to accept this challenge. So let's review this again very quickly. What did I say just now? I said that the superior surface is forming part of the clivus and supporting those neuroanatomical structures and vessels. Also, what the superior surface is doing is, very close to the anterior margin of the foramen magnum, the superior surface is providing attachment to three important membranous structures. From above to below, these membranous structures are, number one, membrana tectoria. What is this membrana tectoria actually? See, membrana tectoria is, if you have studied some parts of the vertebral column, then you will be knowing about the name of a ligament known as the posterior longitudinal ligament. Okay, these ligaments are actually positioned between corresponding vertebrae. So the posterior longitudinal ligament, its continuation onto the occipital bone is known as membrana tectoria. Okay, done. Okay. The next structure which I talked about was the ascending or the vertical band of cruciate ligament. What is this? See, when we will be studying about the cervical vertebrae, we will come to know about this ligament called cruciate ligament. The word cruciate is actually signifying what? That it is plus or cross shaped. So there is essentially a ligament which is cruciform in shape. Okay. Now, if it is cruciform in shape, if it is cross shaped, then obviously what is going to happen? It will have four bands, because it is plus shaped or it is cross shaped, whatever you say. So obviously there will be what? Four limbs or four bands in this case. So of those four bands, I am talking about the ascending or the vertical band, the band which is ascending, not descending or not the transverse one, the ascending band. That ascending band is actually coming on and being attached to the superior surface of the basilar occipital bone. Okay, done. And this cruciform ligament or the cruciate ligament, I'm sorry if I am mispronouncing it, the cruciate ligament, it is actually, I said that it was present between the cervical vertebra, and obviously it must be obvious between what cervical vertebra it is present. Which cervical vertebra are closest to the occipital bone? Yes, of course, the C1 and C2. So the cruciate ligament is present between, yes, the C1 and C2. Between the atlas and a part called the dens of the axis bone. Okay. Anyways, we will be studying about this later when we will be talking about the cervical vertebrae extensively. But for now, let's move on to the third structure which I talked about. The third structure which I talked about was the apical ligament of dens. Apical ligament of dens. What is this? Very interestingly enough, this apical ligament of dens is actually the remnant of notochord in human beings. Okay, so we have the membrana tectoria. From above below, we have the membrana tectoria, okay, which apparently was the continuation of the posterior longitudinal ligament. Then we had the ascending band or the vertical band of the cruciate ligament, okay, which was present between the atlas and the dens of the axis. Thirdly, we had what we call to be the apical ligament of dens, which was the remnant of the notochord. And along with that, we have the pons medulla oblongata, basilar artery, and the basilar plexus of veins, which are positioned or related to the superior surface of the basilar occipital bone. So we talked about the anterior part, we talked about the superior part. It's very easy to actually, scheme through these. Like I keep saying these and you keep listening and stuff, but with repetition, I've said this before, an actual impact falls upon the brain, because if I'm repeating something, it must mean that it's important, or it means that it may be difficult to remember. Hence, repetition is unnecessary sacrifice against time saving. Okay. Anyways, now having talked about those two surfaces, let's talk about this surface, the inferior surface. Now, the inferior surface, the very first thing which we kind of notice is that it has this, tubercle over here. Can you notice it? Yes. It looks a lot like Assassin's Creed symbol, right? Only gamers can understand this joke. Anyways, so this tubercle, which is positioned near its center on the inferior surface of the basilar part of the occipital bone, this has an interesting name. This is known as the pharyngeal tubercle. Pharyngeal tubercle. Okay. Now, actually, the pharyngeal tubercle is providing attachment to a structure. What is that? Pharyngeal tubercle is providing attachment to the pharyngeal raphe. That is interlacement, fusion between the muscle fibers. So the pharyngeal raphe, if it is a raphe, then obviously it is formed by the fusion of certain muscles coming together. What are these muscles which are forming the pharyngeal raphe? Over here in the pharyngeal raphe, this superior constrictor is actually associated. Okay, so what actually forms this pharyngeal raphe then? The superior constrictor muscle, the middle constrictor muscle, and the inferior constrictor muscle. All these three muscles, their posterior fibers actually form the pharyngeal raphe. So if you remember that the superior constrictor muscle was actually associated with formation of the pterygomandibular raphe, then you may remember that this is the superior constrictor itself along with middle and inferior constrictor and the posterior fibers. Obviously we are not talking about the anterior fibers. Their posterior fibers are forming the pharyngeal raphe, which is getting attached to the pharyngeal tubercle. Okay. Now, this pharyngeal tubercle is very interesting. Why? Because as you can already make out, there are two depressions on either side of the pharyngeal tubercle. One superiorly located depression, one inferiorly located depression, or rather one pair of superiorly located depressions and one pair of inferiorly located depressions. Okay, so if there are depressions, then they are obviously meant for something, right? So actually what is happening is that on either side of this pharyngeal tubercle, the depressions that are present, right, they are providing attachment to a muscle. Okay, also in front of these occipital condyles, inferior to the it's looking inferior from the pharyngeal tubercle, but we are actually going to say it is posterolateral to the pharyngeal tubercle. So let me get this straight for you guys. There is a pair of depressions on either side of the pharyngeal tubercle, number one. Number two is there is a pair of depressions posterolateral to the pharyngeal tubercle in front of these occipital condyles over here. And we can kind of make it, right? So actually the thing is, the depressions on either side of the pharyngeal tubercle are providing attachment to the muscle longus capitis. Longus capitis. Whereas the depressions which are on either side posterolaterally of the pharyngeal tubercle, they are providing attachment to the muscle rectus capitis anterior. So longus capitis, rectus capitis anterior. These two muscles, they are actually having their attachments on the inferior surface. I was again going to say internal, but I corrected myself. So the inferior surface and associated with the pharyngeal tubercle. Okay, done. Now, there is another overwhelming information. Just like we talked about those three attachments, do you remember? We talked about those three attachments on the superior surface, just in front of the anterior margin of the foramen magnum. Just like that, the inferior surface also has three attachments. So the inferior surface, it has this pharyngeal tubercle, pharyngeal raphe, the three muscles that associated with it, and it also has these depressions providing attachment to two muscles which we talked about. And now I'm telling that it has what? It has three more membranous attachments. Where actually? Actually, in front of the attachment of the longus capitis muscle. So we said that on either side of the pharyngeal tubercle, there was the depression providing attachment to the longus capitis, right? But I am now telling that in front of the longus capitis attachment, the inferior surface is actually providing attachment to three more membranous structures. Okay? Do not let yourself get overwhelmed. Take a break if you need to, but please do not get overwhelmed. Okay? See, those three structures which are being attached to the inferior surface just in front of the longus capitis, they are, number one, the prevertebral fascia. Okay. Number two, the buccopharyngeal, and number three, the pharyngo-basilar membrane. Okay. Having talked of the surfaces, now we are in a position to talk about the borders. of the basi-occiput. Okay, so I said that these are the lateral borders. So what is the fate of these borders? See, if I bring out the articulated skull back again, so this is the superior view in the interior surface of the skull. Okay, so the internal surface of the skull, we are seeing it from the superior view. So we are here to locate the lateral boundaries of the basi-occiput. So this is the basi-occiput over here. The lateral boundaries, we are seeing that they are actually associated or rather articulated to these bony projections coming from this bone over here. This bone, if I show it laterally, this bone is the temporal bone. Okay, so they are the temporal bones. And what are these structures? They are what we call to be the petrous temporal bone. When we study about the temporal bone, we will come to know about these in details. But for now, we can know that these bony projections of the temporal bone internally, they are the petrous temporal bone. So the petrous temporal bone is getting kind of, articulated. Kind of. It's not actually articulated to the lateral border. They are actually kind of connected to the posterior boundary of the petrous temporal. So these are the posterior boundaries of the petrous temporal area. Now, an interesting thing is, see, this was the reason that I said that it was an articulation, but the thing is, it's not an articulation. Okay, so actually, there is no articulation between the lateral borders of the basi-occiput and the posterior border of the petrous temporal. No, there is no articulation. Why? Or rather, how I'm saying this? Because there is a groove in between these two. There is actually a groove, and we can kind of appreciate the groove. See over here? Yes. So there is actually a groove in between these two, which is actually lodging an important structure. This is lodging what we call to be the inferior petrosal sinus. So the inferior petrosal sinus is actually lodged in this groove, and the inferior petrosal sinus is actually what we can call to be draining into the internal jugular vein. Okay, so if I can make this clear over here, see, do you see these over here? These are the jugular foramen. Okay, we will talk about this jugular foramen just in a minute when we will be talking about the condylar part of the occipital bone. So this jugular foramen is actually bringing in the internal jugular vein, or rather you can say that it is draining out. The internal jugular vein is actually passing through here. So this is the jugular foramen. You can see that the groove that we were talking about, which was lodging the inferior petrosal sinus, it is actually draining into the internal jugular vein. Okay, so it drains into the internal jugular vein, and that is why this inferior petrosal sinus is also considered as the first tributary of internal jugular vein. Okay, having talked about the surfaces and the borders of the basi-occiput, we are now in a position to actually talk about the last part of the occipital bone, that is over here, these condylar parts. Okay, the condylar part of the occipital bone, listen to me carefully. The condylar part of the occipital bone, it is actually divided into two parts. What are these two parts? First is the area associated with the occipital condyles. So the occipital condyles are these over here. You can make them out, very smooth, and very distinct, obviously. and the area associated with the occipital condyle superiorly. So this part is also the part of the occipital condyles. This is one part of the condylar part, whereas the other part of the occipital, or the other part of the condylar part of occipital bone is this. This is what we call to be the jugular process. Okay. So on both sides we have the jugular processes. So the jugular process and the occipital condyles. These are the two parts of the condylar part of the occipital bone. Let's very quickly talk about the occipital condyles first. Okay. See, obviously this should be no surprise that the occipital condyles are what? They are meant for articulation. Yes. The occipital condyle, or rather the occipital bone, we know that it is articulated to the C1 vertebra, that is the atlas. So the joint which is formed is the atlanto-occipital joint. Okay, the atlanto-occipital joint. So the atlanto-occipital joint is formed between the occipital condyles of the occipital bone over here, okay, and the superior articular facets of the atlas. Okay, so that is the reason, or rather that is the purpose of these occipital condyles. They are kind of elliptical or reniform in shape, right? Right. If I rotate this bone, see, there is this hole over here. This is actually a canal. Okay, let me give you a better view. See, do you see it over here? This is a canal just above the occipital condyles. This canal is known as the hypoglossal canal, and it is located in the line of, you may say, anterior 1/3 fusion with the posterior 2/3 fusion of the occipital condyle. Anterior 1/3 of the occipital condyle and posterior 2/3 of the occipital condyle. At that line we have the hypoglossal canal. So obviously it's a canal, so it must allow the passage of some structures, and obviously since its name is hypoglossal canal, so it allows the passage of the hypoglossal nerve, right? But the twist here is that hypoglossal nerve is not the only structure which passes through here. So what is the other structure? The other structure is what we call to be meningeal branch of ascending pharyngeal artery. Okay, so hypoglossal nerve also passes through the hypoglossal canal, and meningeal branch of the what artery? Yes, ascending pharyngeal artery. Okay, so these two structures will compulsorily pass through the hypoglossal canal, but along with them sometimes a vein may also pass. What vein? The emissary veins. Okay, so the emissary vein, we have already talked about them in short, obviously. So emissary vein may also pass through the hypoglossal canal. Done. And another small information, is not bulky, is that sometimes, although it's not present over here, sometimes, you know, what happens is that some bony spicules may be present at the hypoglossal canal, and that will actually divide the hypoglossal canal into a number of compartments. Okay, so that is something which happens sometimes, and okay, that's just a small information. Now see, what's happening is, this is the hypoglossal canal still visible, right? In the interior surface, just opposite to the hypoglossal canal, we can see that there is these two, you know, bony tubercles which are kind of bridging the hypoglossal canal. So the hypoglossal canal, just above it, these over here on the internal surface of the condylar part, these are what we call to be the jugular tubercle. So these are the jugular tubercle. See, this is the jugular process, right? Visible in the frame, right? So close to the jugular processes, the tubercle which is present, that is the jugular tubercle. And this jugular tubercle is actually, see from the internal aspect, it is bridging the hypoglossal canal. Okay, done. Now, sometimes along the posterior border of the jugular tubercle, see, oh sorry about that, yeah, so along the posterior, it's not visible at all over here, but what happens is that over the posterior border of the jugular tubercle, sometimes there are some grooves. Okay, 2 to 3 grooves are present over here. They are present for what we call to be the traversal of the cranial nerves 9, 10 and 11. So the cranial nerves 9, 10 and 11 actually traverse over the jugular tubercle, and for that there are 2 to 3 grooves present along the posterior border of the jugular tubercle. And the jugular tubercle is actually what? It is bridging the hypoglossal canal. Okay. Now let's talk about the jugular process. Okay, the jugular process. See, these jugular process, they are actually projecting obviously forwards, right? But laterally also from the posterior half of the occipital condyle. Now, see, do you see this notch over here? This is the anterior boundary of the jugular process. And obviously that is very self-explanatory because this is the anterior aspect, right? So this is the anterior boundary or the anterior notch of the jugular process. Okay. So what is the significance of this anterior notch? The significance of this anterior notch is when we see the articulated bone, obviously superiorly, can you make out where the jugular processes are? See, this is the basic occiput, right? This is the condylar part. So the jugular processes are part of the condylar part itself. So where are the jugular part or the jugular process? Actually, they are located over here. The anterior notch, it is actually, you can obviously make this out, that it is forming the posterior boundary of a foramen over here. We talked about this foramen when we were talking about the groove just above or in front of this foramen. What groove was this? This was the inferior petrosal sinus containing groove between the lateral boundary of the basilar occiput and the posterior boundary of the petrosal temporal bone, right? And I said that that sinus, inferior petrosal sinus, drained into the jugular or rather internal jugular vein. That is why this foramen is called jugular foramen. So all the structures present around here, they are jugular structures. That is why this process is also called jugular process. And the notch which was close to this is also called the, not the notch actually, the tubercle. The tubercle which was located close to this is also called the jugular tubercle. Okay, done. And you can make out the hypoglossal canal over here in the articulated bone. The jugular process, let's quickly see it once. I said that this has an anterior boundary. What are the other anatomical features of the jugular process? Let's talk about them very quickly once. The next thing that we can appreciate in the jugular process is the lateral margin. The lateral margin is somewhere over here. Okay, the lateral margin. So it has this anterior notch, a lateral margin, a superior surface, and an inferior surface. Okay, so that is the gross features of the jugular process. Now the lateral margin, it is actually rough and obviously articular, and this lateral margin is also articulating with the petrous temporal bone. So see, the anterior margin did not articulate directly with the petrous temporal. It formed the jugular foramen's posterior boundary, and the other part of the jugular foramen was formed by the petrous temporal, right? Whereas the lateral margin is actually articulating with the corresponding area in the petrosal or the petrous temporal bone. Okay, so let's give that a quick look. So this is the articulation between the temporal bone and the occipital bone. Okay, so this is the jugular foramen. So this is the anterior notch. What I want all of you to appreciate is if we can get a better view of the lateral margin being articulated. We apparently can. We can now make out the lateral margin. So the lateral margin, can you make this out? We can see it from the faded out temporal bone. This over here is the lateral margin, the lateral boundary of the jugular process. It is actually articulating with the petrous temporal bone. Whereas the anterior notch over here, it is forming the jugular foramen, the posterior boundary of the jugular foramen. Okay. Now, having talked about the boundaries, let's talk about the surfaces of the jugular process. So the very first surface is the superior surface. See, here it's not again very visible, but in the real anatomical skull, the superior surface is quite deeply grooved. Okay, so it is very deeply grooved, and a very interesting thing happens. See, the superior surface is actually forming what we call to be the terminal part of the sigmoid sulcus, which leads into the jugular foramen, where the sigmoid sinus is continuous as the internal jugular vein. Very, very important. See what's happening. Again, we need the articulated bone for this. So this is the temporal bone. It has been faded off, and this over here is a jugular process. What I was telling was that the anterior surface is grooved. So, not the anterior surface, the superior surface is deeply grooved, and the sigmoid sulcus is actually being formed over here. The sigmoid sulcus leads to the jugular foramen, that is over here, because the sigmoid sinus is actually continuing as the internal jugular vein. Having talked of the superior surface of the jugular process, now let's quickly talk about the inferior surface of the jugular process. The inferior surface, it is actually providing attachment to a muscle, that is rectus capitis lateral. Okay, so the rectus capitis lateralis is actually being provided attachment by the inferior surface of the jugular process. Done. Now the last section of this bone we complete by talking just a little bit about the foramen magnum. Okay, so the foramen magnum is obviously this huge foramen, and it has some dimensions actually. It is actually measuring about 3.5 centimeters antero-posteriorly, like this over here. Okay, and about 3 centimeters transversely, like this. So anterior posterior diameter is a little longer than the transverse diameter. Okay. Okay. So from below, this is the anterior margin obviously, and over here is the posterior margin. See, the anterior margin is providing attachment to what we call to be the anterior atlanto-occipital membrane, whereas the posterior margin is providing attachment to the posterior atlanto-occipital membrane. Okay. See, the midpoint of the anterior margin from below, we are obviously looking at this from below. So the midpoint of the anterior margin from below, this is called the basion. Okay, this point is called the basion. And another thing which I would like to add over here, which I had kind of, forgotten to say. I don't remember having said it. I may have said it. Then it would be just a small repetition. That is, the inferior, not the inferior, the internal occipital crest over here. Can you see it? See, the internal occipital crest, at its termination, it is expanding, right? And here it forms what we call to be the vermion, and lodges what we call to be the vermis of cerebellum. Okay, so towards the posterior part, towards the posterior side over here, what we are seeing is that the posterior margin of the foramen magnum, so it actually makes sense to talk about this right now because we are talking about the foramen magnum. So over here somewhere, the area is expanded and it is forming what we call to be the, what did I say? Vermian fossa. Okay, so there is a triangular depression, as you can make it out already, triangular. There's a triangular depression, it's called the vermian fossa, and it's lodging the vermis of the cerebellum. Okay, now the last thing that we can talk about is what are the structures which are passing through the foramen magnum. So obviously the spinal cord, a part of the medulla oblongata continuing as the spinal cord passes through this. Okay, then obviously what other structures pass through it? Okay, so just one small information here is that there are a special ligaments known as the ala ligament. Okay, we will be talking about them when we'll be talking about the other vertebral structures, that is the cranial, not the cranial, the cervical vertebra. When we will be talking about that, we will talk about this. But the ala ligaments, they are actually attaching to the occipital tubercles, and they are actually dividing this foramen magnum into a smaller anterior compartment and a larger posterior compartment. Okay, so a smaller anterior compartment and a larger posterior compartment. Why? Because of the attachment of special ligaments called ala ligaments to the occipital condyles. Okay, so the smaller anterior compartment, it allows a passage of all those three membranous structures which were actually attached to the superior surface of the, can you make it out? Yes, the basilar occipital surface. The superior surface of the basi-occiput. Do you remember close to the anterior margin the three membranous structures that were attached? The membrana tectoria, the apical ligament of dens, and the ascending or vertical band of the cruciate ligament. These three structures, they pass through the anterior compartment, which is small, of the foramen magnum. Whereas the larger posterior compartment, that will actually allow the passage of many structures, like obviously the spinal cord, the anterior and posterior spinal arteries, the fourth part of the vertebral artery, the sympathetic plexus, the spinal roots of the accessory nerves, and some other structures also. But these are the major structures which are allowed passage through the, what is this? Posterior large compartment of the foramen magnum. So one thing we can all be sure of, that is the posterior compartment is providing the passage for the different vascular structures and the different nervous structures, right? Like spinal cord, the spinal arteries, the vertebral arteries, etc. That is why this posterior compartment of the foramen magnum is called the neurovascular compartment of the foramen magnum. Whereas the anterior compartment is providing passage to mainly these membranous ligamentous structures. Okay, that is why they are known as, or this anterior compartment is known as the osteoligamentous compartment. So the neurovascular compartment, the posterior one, and the osteoligamentous compartment, the anterior compartment. That completes foramen magnum, that completes the occipital bone. So we have finally beaten the first challenging, a hard boss in this game of anatomy. So that is quite an accomplishment for us. But we should not get too full of ourselves, because the road is still filled with much more harder challenges to come. But we will face them just like we have faced this, right? So, okay, fine. Thank you very much. Thank you. Stay safe. Thank you again.